Hi, this is video number 2. We are going to do the abdominal prep using the chlorhexidine. Again, sterile gloves. The chlorhexidine is a little bit different than the DuraPrep. It's going to have a scrubbing property that you need to do at the incision site. You need to scrub at the incision site for 30 seconds. You need to use a timer. Also, because you're going to be scrubbing at the area for that length of time, you're going to have more pooling than the DuraPrep. So the suggestion is to go ahead and we're going to prep the patient with some towels underneath, between their legs, and on both sides. So Becky, can you help me with that piece of it? Because the patient is just laying on the bed, so I'm putting one under her legs, towel on one side, and a towel on the other, because this is to get all the excess pooling. Chlorhexidine prep. The area is a 13 by 13. Of course, if you look at the size, most of our patients are a little bit bigger than that. So you will need to use 2 wands. So, I open up my packaging for my chlorhexidine wands. Get my sterile gloves. And you'll have your garbage or your little friends here that are going to help you, like with your garbage and papers, etc. So I'm going to put my sterile gloves on. Okay. I'm going to grab my wand and my Q-tip out of the packaging. I'm going to crack it. It's going to go to gravity, and you will see the sponge starting to saturate. When the sponge is saturating, you get your Q-tip just like on the DuraPrep, and you clean the belly button. And there's 2 Q-tips. Okay? Your sponge is fully saturated. Okay. So here's your incision site. So I'm going to start from hip to hip. Going back and forth. Start the count, Becky.
Yeah, that's fine.
So this is 30. We're going to do this for 30 seconds. So this is a scrub. So you're just going back and forth. So it's the friction.
2, 20, 25, 30.
So that's 30 seconds. So I had a lot of pooling that was getting collected on these towels. So I probably used the majority of what was in my wand. So I'm going to throw that one into the garbage. Grab my second wand. Again, crack it. Let it go to gravity. And then finish up your prep. Going over, all the way up, clear to close to the breast area. And again, you're going to do little shorts, perineum. You're done there. And then you start your timer for your dry time. Again, it's still 3 minutes. So since we're prepped, you got to be careful taking out these towels. You just want to get them and roll them away from the patient. Roll them away from the patient. So we want to really remember to get those towels out of the way because they're saturated with chlorhexidine, and which it could be a fire risk. So we really need to make sure you take that step and get the towels out of the way. And again, it's a 3-minute dry time, so use your APGAR button on the warmer. So this way we're all on the same page. The doctors can see how long it's been. So you can say, oh, doctor, I'm sorry, it's only been like a minute and a half. So it's visual. Okay, and that's about it. Thank you.